One of the therapies I use more often is the Bowen Technique. This is a non-invasive treatment that can be used on babies from 1 day old all the way through to old adults, say 99-year-old adult. The treatment itself is a non-invasive therapy. It works on the tissues of the body, releasing the tension. The treatments are very long-lasting. It's one of the only therapies you can use on pregnant women as well. No, the treatment doesn't hurt. It's 100% safe. It has no contraindications. The treatment itself works on releasing the tension within the muscles by working over trigger point areas of the body. So I suppose an analogy to it would be looking at a plastic, like a shopping bag, okay? And within your shopping bag you have your grocery bag, and within your grocery bag you have your potatoes and your bananas in your bags, okay? And each of them bags slides very evenly past each other, okay? When something gets a bit sticky within the bags, obviously they have no sliding motion. It's the same within muscles. Generally the muscles slide and glide. When we have this movement, we have a full range of movement within our system. When we have a bit of a sluggish range of movement, it's when these bags become very thick and sticky, and it's where the tissues then start to swell and get dehydrated. This in itself then creates a lot of restriction within the body, pain, aches, stiffness, which over time results in sciatica or nerve restriction. Okay. So what I do with my treatments is I work on, or should I say initially, I look at the balancing of the structure. So I'm looking at balancing the skeletal system of the body, looking at how, assessing left and right, assessing the movement and range of movement of all your joints. And then we go into the treatment itself. And the treatment works on releasing the tension within this tissue and allowing the bags to move more smoothly together. The treatment itself is anything from 5 to 45 minutes, and I work on throughout the whole body. Pregnant women's bodies change shape so rapidly. The body is always trying to counterbalance the growth of the baby in front. Our muscles or our tissues can only stretch to a certain degree. Over time, especially in the second trimester, this stretch becomes quite stiff and heavy and achy for a mother. So the treatments help to relieve this. They also help to increase the space for the baby within the womb. So it's really beneficial for the mother, especially in the second trimester, just for the health benefits, making sure that they optimizes the growth rate of the baby, also helps to keep everything free. The freer you are through the pelvis and through the psoas muscle, the more likely you're going to have a natural birth. Your first trimester, it's amazing for fatigue, loss of energy, nausea and health. Just generally keeps your body at maintenance. Through your third trimester, it is more, as the baby starts to grow even more, you get a lot more pelvic discomfort because everything's starting to stretch to its extent. You get the lax ligaments. And sometimes you get inflammation through your joints as well. So again, the treatment's really good and it benefits everyone really, just to allow the lymphatics to work through, or the lymphatic system of the body to function more correctly, and it just releases a lot of the tensions within the tissues. It helps again by freeing off the womb or the stomach. You get more of a movement through there for the baby to be able to turn into its optimum position. So I've done a lot over the past definitely the past year of being back, working on turning the baby through a natural therapy and hands-on treatments, which are non-invasive to the baby and to the mother. The benefits are endless with the baby. It helps basically set the baby up for the outside world. It helps just to ensure that the baby is being fed, it's absorbing correct amount of nutrients, and its position is correct. Once the baby, or should I say after birth, it helps to quicken the healing of the mother, helps to strengthen the ligaments, and helps to knit the core stomach back together again. With the baby, it can help with colic, constipation, respiratory infections, sclera, antibiotics, any cranium abnormalities, TMJ and gut problems. Generally, an unhappy baby has had a traumatic birth. Usually a slow labour, fast delivery. Inductions, assisted births increase the stress. Baby's primal reflex is safety and to feel it's safe. When assisted births come into play, they increase the heart rate of the mother, stress is increased, and so the baby doesn't feel as safe as it would do within a natural birth. Okay, so what we're looking at here is, especially when you're looking at a forceps or fons ducis, the baby's head is pulled out by the midwife. Well, we're bred for pushing forces. So we're bred for our mother to push us out, not to be pulled out. So what you find is the primal reflex is the baby will just pull its head back and kind of fight that persistence of the midwife. These muscles which interact within that fight, or the primal muscles, are also the muscles that are linked to colic, reflex, respiratory, so which is psoas in your diaphragm. Now, obviously, staying within the C-section of a baby, so an emergency C-section, the baby's pulled out by its feet. So it's been nice and curled up for 9 months, and all of a sudden its legs are straightened and it's exposed. So that puts a lot of shift and strain on the lumbar area of the body, and also through the psoas of the body, again linked into the respiratory and then linked into the digestive problems and gut problems the babies can have. The mother's then put on antibiotics because of the cut and the operation, but she's obviously fed through to the baby. Now, antibiotics is really not beneficial to the baby. It breaks down the microflora in the baby's gut. The microflora is a main starting block for the immune system, and that's why you see a lot of teenage asthma problems, migraines, headaches, respiratory defects basically, and a lot of colic and gut problems within the babies. I think a lot of our problems we have as a teenager and later on in life is a result of our birth trauma. I think everyone's birth is very different, and that creates that seed, of that unique seed of each person's characteristics. But I do also think that when an assisted birth comes into play, we have a lot more problems later on in life, which is things like that. Even jaw alignment, dental work, migraines, headaches, eyesight, your vision, your hearing, all can be down to just the imbalance during your birth trauma. So usually, if I haven't seen the woman prior to being pregnant, I would usually get them to come in the second trimester, and I'd see them twice within the first 10 days. My treatments during, should I say, my treatments will last anything between 5 and 45 minutes, like I've mentioned before. I can treat with light clothing as well, so you don't have to strip down. And I also can treat on a seat or lying on your side. So it's no worry really, it's whichever's comfortable for the pregnant woman. Okay. In the third trimester, obviously, as they're getting bigger, it becomes much more uncomfortable to lie on your side and lie on your back. So I do a lot of my work sitting at this point. Usually, when it gets to the third trimester, depending on the case of the woman, what pain she's getting, what ache she's getting, how she's coping with pregnancy depends on how many treatments. So usually I just advise my clients coming up to the due date for the last month is to come every week up to then, and prior to that probably once a month, just to keep everything balanced, make sure there's no counterbalance going on of the weight coming forward and then your head and shoulders going back.
Everybody carries a baby differently.
Absolutely, absolutely. So everyone's pain is very different as well. My one-to-one treatment is £45. So usually I'll ask my pregnant women to come at least twice, see if you like the treatment, see if it really benefits you. And it's £45 per session then. And then once you start coming much more regularly, we then I do two types of installments, or should I say blocks of treatments. One is 5 treatments, which comes to £36 per session, and then it's £180 up front. or 10 treatments, and it's £32 per session, and it's $320 up front. Now that can be taken throughout pregnancy, up to the due date and over the due date. There is no time frame to that. I usually do advise my clients to leave 2 or 3 sessions after, so we can make sure that the baby is balanced, work on the cranium or the skull to make sure that's realigned, and also to aid the healing of the mother after pregnancy or after the birth itself. So yes.